So let's get a look at the slides. This is from a presentation I gave at the International Society of Medical Shockwave Treatments in Beijing. And we're going to go through the information I presented there on osteoarthritis of the knee. I'd be delighted if anybody fancied following me on Instagram. It's at Physio and Therapy UK. And what we're going to look at here is developing on from everything we just learned in terms of the practical application. We're going to take a little bit of a delve into the science and into my personal journey with my osteoarthritis and my knee itself. And we're going to look at some MRI scans of my own knee 4 years apart. So the science. What we've got here is a paper which is about shockwave treatment for musculoskeletal disease and bone consolidation, a qualitative analysis of the literature. So it's the Journal of Surgical Research. You've got the volume there. So what we found from this paper is that extracorporeal shockwave therapy is effective in preventing osteoarthritis of the knee in rats. Don't get too put off from that. The beneficial effect of extracorporeal shockwave therapy appeared to be time dependent, beginning at 4 weeks after treatment. So as we've said as part of our protocol, we're not really going to touch this person for 3 months after we've done the treatment because we start to see the development. The interesting point about this particular piece of literature, whilst it's on rats, is that it seemed to be preventing osteoarthritis in the knee of rats. So the extrapolation of the information we're going to go on to is that all of the information we've had historically has initially come from rats. There's lots of Chinese studies that look at rats. And not only have they found it to be chondroprotective, but they've actually found that it seems to help in the prevention of osteoarthritis, which might be part of the system in the way in which shockwave seems to at least halt the disease as it stands at the moment, or slow it down at the very best. So we have another paper looking at the efficacy of extracorporeal shockwave therapy for knee osteoarthritis. This is a RCT. And what it says here is shockwave is effective in reducing pain and improving knee function with better results than placebo at 12 weeks. Again, this is where my protocol comes with its 12-week point. After you finish treatment, give them 12 weeks. However, they're saying further pilot studies are needed to determine whether shockwave should be recommended to an elderly or late stage OA or combined with conventional therapies. It is absolutely my point that we should be combining shockwave with our normal therapies. And as for whether it should be late stage or early stage OA, my knee in particular is really quite bad, as you'll find out shortly, or was really quite bad. And yet I'm in my mid-40s, early 40s at the time where we started doing this study of one on me, which I know is anecdotal, but I've used it on people that are mid-stage, late stage, and also early stage. And I genuinely believe, although I can't substantiate this, the earlier you catch it, the better. And there might actually be, on these 2 studies we just looked at, a reason for actually using it prophylactically in, for example, football players. Here's another paper. Extracorporeal shockwave therapy reduces progression of knee osteoarthritis in rabbits by reducing the nitric oxide level and the chondrocyte apoptosis. So nitric oxide levels have been shown to be reduced by shockwave, and this study, albeit in rabbits. But what we're saying is it reduced the progression of OA in rabbits. This effect may be related to the decreased level of nitric oxide. It's likely mediated by the reduced chondrocyte apoptosis, and shockwave may be a useful treatment for knee OA. So what is that telling us? We've got something that says that it can actually stop the progression. We've got a study that says that actually it's helping to protect against it. And we've got studies that say that it improves knee OA. So pretty much everything that we could possibly want from a treatment for a degenerative disease such as this, at the moment of reading this study right now, it's from 2012, we are still of the opinion that we're, only looking at rats and rabbits and the like, whereas really what we need to be doing is extrapolating that across to humans. So one more animal study coming up for you is where we learn about the chondroprotective benefits. So extracorporeal shockwave therapy shows a number of treatment-related chondroprotective effects in the osteoarthritis of the knee in rats. Now, of course, doing these studies on rats is something that is useful. A lot where you stand on studying animals or whatnot, but history has told us that there is a good extrapolation from looking at things that we can do in terms of treatment parameters with respect to animals and being able to move that across into human studies. And what I think is particularly interesting is bringing together all of this information that we've got from the animal population and looking at how that might extrapolate to what's happening in the human population. So this grid that you see here, if you look at the second one down, VEGF, as you come across from group 1, group 2, group 3, group 4 and group 5, we can see the improvements by the time you get to group 5, which had the shockwave therapy. So we're seeing a huge cellular improvement in the bone tissue, VWF, VEGF, BMP2 and OCN, huge improvement by the time you get to the usage of shockwave therapy. So how might we be able to extrapolate that across into human studies, and what does that mean for us in the findings that we're getting? So here is another rat study. Extracorporeal shockwave therapy shows a number of treatment-related chondroprotective effects. So same study. A number of treatment-related chondroprotective effects in the osteoarthritis of the knee of rats. So let's move ourselves on to going into the human study. So what I'm going to present to you in just a second is a couple of randomized control trials where we look at how shockwave therapy has been instrumental in improving osteoarthritic knee pain. And just before we get to that, I want to explain a little bit about my case where my left knee has been really quite painful and lacks a lot of movement based upon what I would say is from an ACL, large ACL injury, anterior cruciate ligament injury, where I had a full rupture. I then went on and had surgery, and of course that was something that in 2004 when I had the surgery I was told that I might well suffer osteoarthritis of the knee. So I can tell you I've got a vested interest in this, but what's interesting is because I was in a lot of pain, just started using shockwave therapy on my own knee anyway and found great results. It was only after that I found these studies on rats and rabbits and the human studies that we're going to look at now. So osteoarthritis of the knee and extracorporeal shockwave therapy. We had an RCT here of 70 people and it was shown to reduce pain. The visual analog score actually started at a mean of 7.6 out of 10 and reduced down to 3.8 out of 10. Now, in most cases of your patients, if you could offer them that kind of reduction in pain, they would happily go for the treatment. The WOMAC, a well-known study for knee pain and knee disability, significantly improved. Now, this study is back in 2013. This study actually happened before I started working on my own knee, blindly, by the way, starting off with radial shockwave therapy. And yet there was already an RCT that I hadn't at that point discovered, and you just note sport praxis at the bottom there. That's Carsten Knobloch from Germany, who I work very closely with, kindly allowed me to use these slides. But I recommend that you look into these studies. Just about all of the bone studies will show you a use of focus shockwave. I myself started using radial shockwave. It was very, very painful on that medial joint line, a bit easier in the keyholes than as we showed earlier, but I still had a significant reduction in pain, and I would say the stability of my knee improved. However, all these studies are using focused shockwave. Here's a bigger RCT of 120 patients. And what it's saying is improved range of movement. Well, I will completely agree that shockwave improved my range of movement, not only of mine, but also of all of the patients I've treated. Muscle power and improved stability are definitely key factors. Now, I could make an argument that by reducing the pain, increasing the amount the person uses that knee is one of the reasons why you get this increase in muscle power. Because do I think that using shockwave therapy is actually giving muscle hypertrophy or whatnot? No, I think it's a reduction in the muscle inhibition because we've got a reduced pain. Therefore, the patient uses their knee more often, they get stronger, their balance improves. This particular study was shown to be significant versus ultrasound or training alone. So I don't really believe too much in the use of ultrasound, I'm afraid, but suffice to say that there are still some people that use it heavily and believe in it. Well, shockwave has proven to be significantly better than that, or just training on their own. So one of the things you'll find through all of the research is that when you put shockwave against just training, it tends to do better. When you combine shockwave with exercise, it's always better than either of those on their own. Let's look at my own knee. I mentioned to you before, since 2003, I injured my ACL. I had reconstruction surgery. In 2006, I was getting pain again, so I had a cyst aspirated and I had the metalwork removed. In 2010, still in a lot of pain, the MRI confirms quite significant osteoarthritis. By 2014, I was awake at night, I had a limp, I had a distinct loss of flexion. I was probably about 110 degrees, someone in the early to mid 40s. By 2015, I was shown I had advanced OA. In fact, the surgeon told me I had the knee of an 85-year-old. So as I just said, I commenced radial pressure wave, radial shock wave, and I was repeating those every 3 months. But it was in 2018 that I started my journey with focused shock wave. Now my protocol is, as I've shown you today, radial pressure wave and focused shock wave. I do 6 sessions over 6 weeks. I allow 90 days for the synthesis of that treatment, and it's combined shockwave again for 6 more sessions. And then we treat at 6 monthly intervals. There is a significant reduction in pain within 6 weeks. The symptoms are reduced long term with these biannual treatment sessions. But if you just treat someone once and you don't go back to them, you will find that unless you do that repeated treatment, first of all after 3 months, then after 6 months, then I don't think we can expect the treatment benefits to keep building on one another, but certainly I don't think the effects will last. At the moment, we're looking into how the treatments build. So let's take a look at a couple of MRIs from my knee. These scans show only a mild progression of the disease over 4 years. So we've got the 2015 scan, the 2019 scan, but one of the biggest differences is you're looking at a significant reduction in that bony edema from the picture on the left to the picture on the right. I've got 0 pain. I've got full range of movement. I'm 100% happy with the results. But still, there's an increase in the chondropathy. I've got an increase in size of osteophytes within that 4-year period. But I am pain-free. I'm mobile. I don't run often, but I do cycle a lot. When I do run, I'm fine as long as I have 2 or 3 days rest in between. Well, most people with a knee of an 85-year-old will be pretty happy with that level of activity. So in conclusion, the literature is asking for more pilot studies. That's one of the reasons why I did my own study on my own knee. The results show a significant reduction in pain and improvement in function. My own knee suggests that perhaps if you were to catch the disease early, it's got a greater potential, although mine could be considered late stage. My goal is to take these findings and my protocol to a larger scale study. Unfortunately, coronavirus has stopped us from doing too much at the moment, but I'm doing more and more patients, getting more and more anecdotal evidence, and the amount of studies taking place around the world now on OA knee and OA hip are significant. My question is, if shockwave reduces pain and restores function, clinically, those goals have been achieved. and I have no reason to think anything other than this would be a great adjunct to the way we treat at the moment. It's my overall belief that in terms of osteoarthritic type conditions, that Shockwave is absolutely the future. I believe strongly that if we could get some really good clinical research data, we could find that by using it on things like professional football players that we know suffer with OA knee, and those that didn't just do what they normally do, I think we'd see a significant improvement later life in the way their knee was functioning. It's been an absolute pleasure to talk to you today, to give you this presentation. If you want any more information directly from me, then paulhober.com is my own site for Shockwave. But many, many thanks to DJO in Australia and DJO Global for putting these webinars on for you lot. I really, truly hope you enjoy them all.
I'm about to have my 6th session of Shockwave therapy. Previous to having it, I couldn't walk very far without having to stop and rest. I'm now able to walk quite significant distances and I don't have to rest, so my walking has definitely improved, and I'm now able to go up and down stairs correctly, whereas before I had to do one at a time, just leading with the left leg.
Right, this is my 6th treatment today, and there's been about a 70% improvement in my knees. I have no pain at all when I'm walking on level ground, slight pain on hills and stairs, but absolutely perfect on level ground. I'm very impressed.